push this as a physician. They say you really should have a trial of labor after a cesarean. And then they say, no, I don't want it. You know,
The mothers say that?
Yeah, the mothers say.
Which mothers?
Because they're terrified.
They've been frightened. They're uneducated.
Well, this is where they really need to be educated.
Yeah.
The safety.
Yes.
And I teach residents and medical students in New York, and I tell them once this is always a trial, unless there's a medical contraindication to it. You know,
And what would you classify as a medical contraindication?
Well, if they've had a cesarean, the vertical.
Okay, because of the possibility of tearing or rupture.
Rupture, yeah. Rupture's
But if
higher.
they've had any of the low transfers,
Right.
then they should have
So
a
why are
trial.
they still doing the vertical
Well, but
incisions then?
yeah.
Well, they have to do verticals when they have a cesarean for a very, very premature baby.
And the uterus is
And
high.
then, you know, then they have to do it there. You know.
But they do them often on plus-size women, and that's pretty unnecessary too. They do them on obese women, and they will.
No, they shouldn't.
They shouldn't. No, they should not. And innovation takes 17 years to diffuse in a profession.
But what we have to do is we got to keep educating women.
Yeah.
Yes.
That
Yes,
they tell their
100%.
providers.
But then we need to stop
contracts.
fear-mongering to women. That is your group. Our group is educating,
Sounds like
but we
he's
can
on the
only
right
educate
way.
as far as the ACOG gentlemen and women stop creating the
But,
fear.
and then the other problem is the hospital. You need a hospital in order to have a trial of labor. And then you have to have everyone available. In other words, the obstetrician has to be available. There's an operating room, but the anesthesiologist has to be available. And there are a lot of anesthesiologists say, I'm not coming in.
Well, but that's also because they've defined, but right, because ACOG said readily available,
Readily,
but there was no definition of what readily meant,
Yeah.
right? So does that mean 10 minutes available, or does that mean, you know, like he lives within 10 minutes of, which a lot of hospitals, like where I live, that do offer VBAC, that's what they've defined as readily available.
Yeah, you have to have the OR, you have to have anesthesia there.
Right.
You have to have the
But it
obstetrician
doesn't
there.
say that they have to be on staff. It does not say that they have to be on site.
Yeah, but they
have to be
for the safety of the baby. If a rupture does
So
occur,
then that's
you
not
only
safe to
have
do any
18
birth,
minutes.
though, right?
Exactly.
Right, but then it's not safe to do any birth at that
Because any birth
hospital.
could turn to an emergency.
Right.
And any woman could rupture regardless of cesarean.
Right.
And anyone can have a percreta, not perceta.
Rupture.
Any woman
you
can
know.
have placental
Yeah,
Any
you
woman could bleed out after due to a hemorrhage. So what exactly is considered the safe parameters if you guys don't actually qualify safe parameters?
You know, the thing is, the safety, the first sign of the baby has little heart.
Right, yeah, right.
All right, so that what I teach the residents, what I teach my family is that as soon as you see that, then go into the operating room.
Okay, so what
As
do you
long
mean
as
by
the baby,
deceleration?
yeah.
What does this call it? Baby fetal in birth.
Yeah, it's called
Head
they go
contraction.
category 1, category 2. They're category 1s. All right, then everything's fine. If they go to category 2, the safest thing is to go to
And what numbers are category 2? How long is the C-cell? What does it look like on the other end? How long are you waiting for baby to react? How far are you allowing baby to descend? Because these are all kind
Well,
of
you have
blurry
to make a
lines.
decision because, you know, what happens?
And what if the decisions are chronically arbitrary?
Yeah, but the uterine rupture is you know, like
Uterine rupture is terrifying, but you guys still use side attack.
You know,
Right.
we don't use sighted
Some hospitals do.
Not for VBAC.
Not
Right.
No, but
Right.
some hospitals still put send the people, like women who are trying to do
What
that,
you
to
mean?
speed it up. So we are actually incurring issues on your end that are precipitating the mother who is attending the feedback.
and here's the other thing.
So what are we, like, what are you clarifying? I'm not trying to attack.
Yeah, no, we're
I'm
really,
asking
like,
for
asking.
clarity.
Really
Because I want to be able to say now, well, I was informed by an unnamed doctor. But we just